Back to school time means more than just school supplies. It's a time to get a checkup on your child's health before sending them off to be back in the classroom. And joining us now to talk more about back to school health is Omni Family Health's Dr. Grace Tidwell. It's good to see you, Dr. Tidwell.
Good to see you. Thanks so much for having me today.
Yes, of course. So let's get right into this. Why are back to school physicals and sport physicals so important?
So they're really important because they allow us to be proactive about our children's health. During a physical, your medical professional is going to screen for any potential physical and emotional risks to help ensure that your child is ready for a healthy school year. We'll also get them up to date on their vaccines to prevent other illnesses.
I know a lot of kids maybe haven't spent so much time with, so many kids. So how can parents keep their children from getting sick when they return to school?
So kids can stay well by being reminded to wash or clean their hands regularly with sanitizer or washing with soap and water. And be sure to do that before every time you eat and before every time you touch your face for any reason. We should also remind them not to share food or drinks with other children right now. They should be wearing their masks, physical distancing, because all of these things can help. And of course, we need to be sure that they're up to date on all of their vaccines.
I know one big concern for a lot of parents is sending their child back to school and the possibility of getting COVID. What can you tell parents about that to reassure them?
Yeah, so it's a really legitimate concern. We are seeing a rise in COVID cases right now. And we know that the Delta variant is twice as contagious as its predecessor, the Alpha variant. So it's so important that we get kids back into the classroom, but we have to be sure to do it in a safe way. So things that are going to help with that are masks, distancing, really good hand cleaning and regular hand cleaning. For our kids that are 12 and older, we have to get them vaccinated against COVID with the Pfizer vaccine. We are looking forward to seeing the data on the vaccine in kids younger than 12 and hopeful that we're going to have a good option for protecting them with a vaccine in the future.
What about other seasonal diseases like the cold and flu? Are those going to be worse because kids haven't been around other children so much?
So possibly we are seeing a rise in of other viruses that were not passed around previously because we were all sheltering in place. So kids can stay well by being reminded to wash or clean their hands regularly with soap and water. They should be wearing their masks, physical distancing, because all of these things can help.
What about getting a flu shot? Is it important for kids to get flu shots going into the school year?
Absolutely. So we've learned to live with the flu, but just as a reminder, it killed an average of 36,000 people a year in the last decade in the US. So just like the COVID vaccine, the flu vaccine saves lives and prevents suffering.
Well, thank you so much, Dr. Tidwell. To go to their website for more information, it's omnifamilyhealth.org. I just want to thank you, Dr. Tidwell, for joining us today.
Thanks again.